Welcome to Around Kitsap. Our topic today is homelessness in Kitsap County, which is a huge topic, and the numbers are growing in our community. Here to share information with me are members of the Continuum of Care Coalition, and we're going to hear exactly what that coalition is all about. But joining me today, Terry Schroeder. Terry is the coordinator for the Kitsap Continuum of Care Coalition, and we're really being really sensitive to not using the acronym, so you're going to hear us say the words over and over again. Next to Terry is Rochelle Doan. Rochelle is the chair of the Kitsap Continuum of Care Coalition. And finally, Kirsten Jewell. Kirsten is with the Kitsap Regional Coordinating Council, another huge word, but she's the Housing Grant Program Manager, and she has really been working very hard on a document we're going to talk about later in the show. But first of all, we're going to talk about the huge topic of homelessness. And Terry, start us off. Talk to us about who is homeless. What do the numbers look like? Who are they?
They're anybody. It ranges. The age is a huge range of people. We're getting more information on youth than we have in the past. That's still a difficult age group to get information on. Mm-hmm. The number of older persons who are homeless is increasing a little bit. There are about 20% of veterans who are homeless. People, and the primary reason for the homelessness is economics. That's when they're completing a point-in-time count survey, they're asked what circumstances caused their homelessness, and that by and far is the largest number. Job loss, other economic losing their home, family crisis. Those are probably the primary reasons. Many of them are disabled. Many of them have addictions. And you don't know whether those addictions and those disabilities were before they became homeless or happened after they become homeless. And I know that there are many that it probably happened afterwards because they've been homeless for a long time. Many of them indicate either many episodes of homelessness, meaning that they were homeless, they had housing, became homeless again, or have been homeless for over a year. And that's a long time to be without a
Terry,
home.
I want to just clarify. It's my understanding that actually the vast majority, like more than 50%, more like 60%, are homeless for a relatively short amount of time, and that there's a smaller population of people who have more significant challenges and barriers to housing, maybe undiagnosed mental illness or chemical dependency issues, that tend to be homeless for a longer time. Is that?
Absolutely,
Okay.
absolutely. It is. It really is a higher percentage that is really short term, and are able to get some help and get back into housing and back on their feet. For some of those longer term, it's just because they've been homeless for so long. It's much more difficult.
My question was going to be, so you're homeless, you've been homeless for quite a long time. How would you even begin to look for work? And if you're looking for work, how could future employers find you? Do you have a cell phone? Are you checking in somewhere? The barriers and blocks and hurdles have got to be immense.
The barriers are.
Let's get on to defining who the Continuum of Care Coalition
Well,
is,
that
and let's hear about that.
You know, there's always a lot of acronyms and words that get put in place, but actually it's a really important group of agencies and people who care deeply about homelessness. The continuum of care in our county formed early in the 1990s. It's been around a long time, and through the years more and more agencies have come on board, so that right now we have 43 agencies that participate, and they might range anywhere from faith-based group, Kitsap Rescue Mission, taking it to the streets, who do a lot of street outreach, to Catholic Community Services, to the housing authorities, both Kitsap Housing Authority and the Bremerton Housing Authority. And it also sort of specialty services providers like Kitsap Mental Health Services that also have some housing for clients. The chemical dependency treatment providers like West Sound Treatment or Agape. So it's a very vast network of people who are involved in attempting to find some solutions, long-term solutions to homelessness.
So
and
they
housing.
really are the agencies and individuals who actually work with the population, helping the
Absolutely,
population.
and one that I did not name that I really want to name is Kitsap Community Resources, because they provide such a vast array of services, like you were just referring to, that can be supportive services in addition to actually providing housing. So the group's mission is to ensure that there is a plan for ending homelessness, which is the ultimate vision. And you know, we've made enormous headway through the years, but as Terry was talking about with the economic conditions of the last 4 years, it's been very difficult. And you know, you can build housing, and that's wonderful, and then you have to be able to maintain it. So it's a big challenge, and it's a community issue. It's not, it doesn't belong to any one person. It doesn't belong to the people who are homeless, and it doesn't belong only to the agencies that work with it. It is our entire community that we see come forward to care about it. So,
Kirsten, tell us about the relationship with Kitsap Regional Coordinating Council and the Kitsap Continuum of Care Coalition. What's the relationship there?
Well, the Kitsap Regional Coordinating Council is our local council of governments. It's made up of representatives from the 4 cities, the Kitsap County government, the 2 tribes, the Navy is an ex officio member, and we have the Port of Bremerton as well. So it's really a forum that talks about issues that span the whole county and are cross-jurisdictional. The primary topics that they are involved in are transportation grants, land use planning, and homelessness and housing. So the housing component is carried out through a mandate from Washington State Legislature that created a couple of pieces of legislation that govern creation of affordable housing and addressing the issue of homelessness. And Kitsap Regional Coordinating Council is sort of the implementing, managing organization, managing government entity for those pieces of legislation. The affordable housing is primarily just a grant program to support existing affordable housing or promote development of more affordable housing or provide operations and maintenance, as Rochelle talked about, for affordable housing. The homeless housing legislation is much more comprehensive and really looks at how, as a community, can we, each county individually, collectively, get together and come up with a plan to end homelessness. How can we implement that plan with the grant funding that the legislature sort of provides or mandates, and then how do we collect information about how we're doing about reducing homelessness in the community.
Excellent, excellent, excellent. Terry, back to you. I want you to tell us a little bit about the point in time and how often is it done, when is it done, and what information does it provide?
It is done once a year, and it's mandated by the state to be done annually. It's mandated by HUD, the Federal Housing and Urban Development. I had to think about that because I always say HUD.
a major funder.
Yes, a major funder, and they mandate that it be done the last full week of the month of January. And so,
And who does the work? Who goes out?
we hold a Project Connect event, which is an event where
right.
vendors and service providers come and provide information and services, and those who are homeless or vulnerable attend. And we start with that. That's kind of our kickoff. And then the various organizations, food banks, Kitsap Community Resources, Kitsap Mental Health, the treatment centers, all get surveys from folks that they are seeing that are homeless that day.
And that
then-
event is usually held at the Sheridan Park Center,
Yes,
is that correct?
that is
right on the bus
correct.
line for folks to
Right.
get there. So the idea is to bring the homeless to this one location so they can, number one, be up to date on what services are there for them.
What services, and get some
eyeglasses?
services. The eyeglasses
Dental?
have been the biggest service that people have gotten. I think it dropped a little bit this year, and I think it's because a lot of the people already had gotten their glasses within the last couple of years, so didn't feel the need to go back.
Okay. Okay.
You know, I think we've met some of that, but there's still a lot of
But
people
after
out
that,
there.
after the Project Connect, then people actually go out in the community
the-
and try to connect with the homeless?
We try to do it in the agencies that typically serve the homeless, the food banks, the service providers, that kind of thing. And then the larger meal programs, like Walt's program, the Salvation Army, and taking it to the streets ministries has really done the outreach piece of it, because they're going out anyway. They have the relationship with
Right.
the homeless people.
Right.
If I go out and try to talk to them alone, or me and a buddy, they're not likely to even talk to us, or definitely not provide information. I mean, several of them won't provide information to taking it to the streets ministry because they're fearful of any kind of tracking, and that's reasonable. It is voluntary, so, and it is a point in time. It's not even meant to be an overall count of all the homeless. It's kind of like, this is the number that we counted this year at this point in time.
Got it. Got
And
it.
one of the interesting things, and I think the reason why the point in time count is very important, is because it is the single benchmark that the Washington State has put in place to measure our progress in reducing homelessness. And even though it's widely considered to be a flawed methodology and benchmark, because there's so many factors that affect it, the weather, how many volunteers you have, who's homeless and whether they want to be counted, it's still kind of what the measurement tool that's been established as our
Right.
baseline.
Right.
Right.
Rochelle, can you talk to us about youth, children, especially in our schools in our county?
I can speak to part of that. I can tell you that probably a decade ago, we began to really take a deeper look at what the issues were around kids being homeless. Often we held an image of it always being an adult. And when we began to realize that there were little children who were sleeping in cars with their parent or their parents at night, it was deeply disturbing. And so we began to get a count around that through the schools. And where I'm not, I may look to Kirsten to know if you have that actual count, because it's not coming to my mind of where we are right now with that.
Well, we know that the school districts are each required to identify children that they believe to be homeless in the school districts, and of course it's an undercount because a lot of families are very fearful about both fearful about being identified as homeless because they're concerned about the implications for their families being broken up, but there's also such a social stigma about being homeless that kids don't want to say that they're homeless. Even so, we know that the school district reported last year about 725 homeless students over the course of a year had
And-
experienced homelessness.
And my recall is the largest number is, I want to say, in the central Kitsap area, and then followed by Bremerton.
We also know that sort of that's the school-aged component of homeless, but we also know that about 25 to 30% of the homeless that we count in the point-in-time count are children as well.
Yeah, and
That's
then
a significant number.
Yeah, and I want to come back to the question. That's sort of the school-age children who maybe are still with a parent or caregiver, but then we have a whole group of youth who have left home, often under very unfortunate circumstances, great difficulties. Children do not leave home easily for the most part, and so the continuum of care and the homeless housing plan that we'll be talking about later put a lot of emphasis on trying to address that issue. And through the work, and really, work takes a long time, work that began, I know, in the late 90s with Coffee Oasis here in Bremerton. We were able to focus on increasing and for the first time providing a youth shelter for young men and women. I want to say maybe 16 and over. I'm not real clear on that age, but it's 13. It's
13 to
13
17.
to 17. It's amazing that this has finally, just this year, has occurred right here in our community, and it's
And
a gift.
through the work of Coffee Oasis and also Richard Lemieux's book,
Yes.
putting a face to homelessness, and the book Breakfast at Sally's really honing in on, wow, this is you read the book and it's like, I know all these places that Richard talks about. It's
Exactly. And when you mention Richard's book, and I know we won't focus there, but through that book here in Bremerton and his experience at Salvation Army, work has been inspired throughout the nation around homeless issues. It's amazing.
Right. Right.
I wanted to loop back and just make one more comment about homeless children, and that's that in addition to being a crisis for the family and the child at that time, there are so many studies that demonstrate that if you are homeless as a child, you have a much higher likelihood of doing poorly in school, having long-term health issues, and most importantly, being homeless as an adult. And so you see where that cycle starts of if you're homeless as a child, you have physical disability, you have health issues, you aren't as well educated, you don't have as many job opportunities, so you're more likely to be homeless as an adult, and then your children, and so you just really see how this starts a terrible cycle.
And I just want to piggyback for just a moment on that, because it's something I think we'll be hearing about more in our community in the future. And that's what you perhaps reference is called adverse childhood experiences. And there's been a lot of work done around that lately to begin to understand that when you have these extremely challenging and painful early experiences, we're seeing that as young adults, you're more likely to have hypertension or diabetes. So it begins to affect an entire lifespan.
Yes,
and that's why when we talk about why this matters to the community,
Bingo.
that's why it matters.
Bingo.
And while children are homeless, whether it's living outside, living in a car, living in an emergency shelter, or living with family and friends, any unstable living environment, their school performance suffers. It's much harder for most of them to complete their school.
I'd imagine kids
Or
trying to do their
just-
homework in the back of a car or
I
in a
can't
tent,
imagine.
and how can
Or
How
in
could
a
you?
room that you're sharing in a friend's house with your parents and one or two siblings. It's got to be
And
very
certainly
difficult.
contributes to emotional disturbance, because which of us would not be distressed?
Absolutely.
Yes.
Absolutely.
Yeah.
On that thought, we're going to take a break, and when we come back, we're going to talk about the homeless housing plan update, and get into the meat of that and what our goals are as a community to end this problem in our community. Stay with us, we'll be right back. Well, Welcome back to Around Kitsap. We're talking about homelessness in our community, and we really painted the broad brush of who is homeless and services available. And now we're going to go into the Kitsap Homeless Housing Plan update. And we did a plan about 4 years ago, so now we're doing this update. Kitsap Regional Coordinating Council, along with the Kitsap Continuum of Care Coalition, held 2 stakeholder meetings in January to really get the meat of the plan. And Kirsten has been doing the update and really has been focusing on facts and data. And let's really get into the meat of this plan. First of all, tell us about the change of philosophical approach.
Sure.
Let's get into that. I think that'll kind of really...
And I just wanted to back up and say that I've also been working with a really excellent group, a committee, the Homeless Housing Plan Update Committee, who have put 6 months of really hard effort into collecting information and having focus groups with homeless clients and doing a
Excellent.
provider survey. So there's been just a tremendous amount of input into this plan, and shortly the result will be released. So I wanted to just talk a little bit about that philosophical shift. 4 years ago, when we wrote the plan with a similar kind of situation, similar input, we really approached it from a sense of, here's the different types of housing. There's affordable housing and transitional housing and emergency shelter. And these are the services that we need to provide with them. And this year, as we did the research about what national plans and other communities' plans are calling for and sort of best practices, we really decided that it needed to have a different philosophical sort of approach, and that is really looking at how we can help families become self-sufficient again. So the first objective in the plan talks about how can we maximize the efficiency of our system. What things can we do to get the most out of the existing system and provide more resources to address homelessness. The second objective really starts at that continuum of how do we prevent homelessness whenever possible, because preventing homelessness is really the single most efficient and economically viable way to reduce homelessness, for many of the reasons that we talked about. But if a family does become homeless, the third objective talks about how do we provide immediate housing and connection with services and assessment of their barriers to housing. How do we immediately provide a roof over their head? Once we've provided that, the fourth objective really acknowledges that there's a lot of different tools that we need, because every homeless household, and household means either an individual or a family group, how do we provide every household with the tailored services that they need, the tailored housing and services, because everybody becomes homeless for a different reason and has different reasons why they aren't able to be self-sufficient. So we need to provide a broad range of different housing and services packages to meet each individual household's needs. And that could be families that have relatively low barriers to self-sufficiency again. They might just need some short, shallow subsidies of housing and some job training. And that ranges all the way to households that have significant long-term health, mental health or physical health or chemical dependency issues, and they're going to need a lot of subsidized housing for a long time with a lot of services. And there's really everything in between. The sort of the national and state trend is to try to get people into permanent housing as quickly as possible, and that's often called under the umbrella of housing first. Let's get people permanent housing first, and then provide them the services that are specific to their needs. The fifth objective talks about, once we have people stabilized in this kind of housing, what are the broader community supports that we need to be providing to ensure that people can maintain economic independence? And those are things like affordable housing, access to education, job training, affordable health care. I mean, these are all the things that people need to stay self-sufficient. And those in turn become a prevention mechanism as well, because if we have adequate affordable housing and health care and job training, then people are less likely to become homeless again. And the last objective really challenges us to address underserved populations in our homeless continuum. And those populations right now that we identify are people exiting jails and prisons with criminal histories have an extremely difficult time getting employment or getting housing, and it makes it very difficult for them to become self-sufficient. And we know that we have approximately 10 to 20 individuals being released from jail in Kitsap County a month, and that there are anywhere from 10 to 30 people who have been released from correctional institutions in our community every month as well. So there's a significant population that we haven't really dealt with.
That is significant.
The second population that we know we need to better address is people who are chronically homeless, who've been homeless for a long time, and typically that's because they have really significant barriers or complicated issues to resolve before they can be self-sufficient again. And then we identify a third population, which is new. We sort of, last time we identified youth as a population that needed particular focus, and now we're pleased to say that they are receiving really great access to services, and they still need to continue support for those youth services, but they are not an underserved population anymore. But we recognize that looking at our demographics, the elderly and aging are in fact the ones who we need to start planning for as we see the baby boomers aging. And we recognize that there are very specific types of services and expectations for older homeless households. We need to start planning for how to address those in the future.
Wow. That's a lot of information, a
Yes.
really lot of information. In probably how big is this plan that you've been working on? How many pages do you have in front
I mean,
of you?
obviously, we do our best, the committee does our best to keep it as concise, because the last thing we want is for it to be a doorstop. I mean, we really want it to be an active document that's used in the community. You know, there's probably about 30 pages of appendices, and then there's about, I would say about 40 pages which are information about what we've accomplished since the last plan. That's
Excellent.
the progress report. And then we have a section that talks about the state of homelessness right now, what our demographics are that we are aware of right now with the great data that we collect, and identifying some gaps and barriers. And then there's about 30 pages which are our action plan. This is what we say we're
Great.
going to do. These are the objectives that I just talked about, and what are the specific strategies under each of those objectives that we need to undertake in order to be able to address homelessness. Now, obviously, we can't do all of these strategies, and so really the key is about prioritizing those. And there's
Excellent.
going to be a lot of work done in the community over the coming months and the coming years to figure out how to prioritize all of these different strategies that we've identified.
The plan will be presented to the Kitsap Regional Coordinating Council on March 26th in the Norm Dix Government Center at 10 a.m. If you would like to participate and offer public comment, you may go to the Kitsap Regional Coordinating Council website at kitsapreginalcouncil.org. Click on Housing. The plan is there.
It will be there as of March 1st.
It will be March 1st. You can make comments. You may come to the Kitsap Regional Coordinating Council meeting and have public comment at that time.
And you can also submit written public comment in advance of the meeting starting on March 1st. We have a
Starting
written
on
public
March
comment
1st.
period March 1st to March 26th, and then you can also make oral comment at the meeting.
Excellent. Please help us. Please read it. Please familiarize yourself with it. It is a problem in our community. It is an issue, and we're working on it. Thank you so much for coming in and talking to us today.
Thank you.
It's our pleasure.
And thanks for joining us around Kitsap. We'll see you next time.